I know what you're thinking.
Well, I've never met a psychic, but give it a shot.
You're wondering why I'm showing up again with another pet, but here's the situation. Sage has been throwing up for the past several days and...
Yeah. And your first thought was that he'd get over it, and that maybe if you stopped feeding him table scraps, he'd be okay, and if he got enough sleep, he'd be fine.
Okay, now you're psychic.
Yeah, well, I cheated. It's the same thing with every owner, but I don't have to be a psychic to know that with the doctor on your side, Sage will be just fine.
Never leave a dog with anything small. Puppies are the best, most annoying pets in the world.
Maybe he doesn't like your hand. Well, it doesn't take a psychic to figure out he's hurting there.
When I see you work, I think, wow, what have I done today? If you think you're doing it wrong, you're crazier than I am.
Man, that's gotta hurt. Could be better. Hope this'll tide him over.
His belly might be a bit bigger than usual. He doesn't want me touching him right now. Now that you mention it, my cousin came by with her baby. Sage was playing with some of the toys, and it was right after that he started getting sick. I bet you're proud of what you do. I don't feed Sage table scraps too often. Okay, now I'm getting a psychic flash.
I can hardly wait for this one.
I'm sensing that soon I will be taking home a healthy dog after thanking the doctor profusely.
Well?
Thank you, doctor. I really mean it.
Sage bit off a bit more than he could chew. In his case, he started having problems right away. Foreign bodies can remain in a dog's stomach for weeks to months, causing only intermittent problems. If inducing vomiting doesn't work, the best long-term solution involves surgery or endoscopy to remove the blockage. Once that small toy is out, Sage's recovery will hopefully proceed without any problems. You diagnosed this patient accurately. You never sidestepped the important questions. I'm pleased with how you treated this case.
I got here as fast as I could.
What did you do to your dog?
What did I do? I spent time with him, I ran with him, I showed him everything in nature that he couldn't find at home. What didn't I do?
That's a nice speech, but your dog is unconscious. Can you tell us what happened?
I was hoping you could figure that out. If you'll excuse me, I've got to cool off.
Okay, doctor. You got your work cut out for you. Ready?
I work from home, so I'm with Julian all the time.
Poor dear is down for the count, seeing blue. I hope we can save him. Heart's not beating to any tune I know. I know what dry gums mean. His heart skipped a beat, but I don't think he's in love. Hopefully, this will turn the tide. That's really unsteady. What to do? Wow, he's really hot. He's probably in shock. Lidocaine will solve part of his problem. Sometimes the simplest treatments are the best.
You have the skill of a doctor and the grace of a gazelle. I've never seen him foam at the mouth before. It's weird. I think it was near 100 degrees today. When I picked him up, he seemed hot. But then again, so was I. Today we went on our morning walk later than usual, and he fell unconscious within 20 minutes. I did everything for Julian. Everything with him. And that was the problem, wasn't it?
No, it was you taking him out in the heat. That was the problem.
I deserve that.
Look, it's obvious you love your dog. Just remember, taking care of him is as important as loving him.
I'll make sure I do both from now on. Thank you, Doctor.
The dog Julian was suffering all the symptoms of a severe case of heat stroke. Heat stroke commonly occurs in large dogs in the early summer, when owners tend to overdo exercise. When a dog's body temperature exceeds the dog's ability to pant, he no longer has any means of dissipating the heat. He will collapse with muscle cramps and headache, and may experience irregular heartbeat, vomiting, diarrhea, and even coma. Sometimes this condition causes the body both to clot and bleed internally, which could be lethal if the patient goes untreated. Early intervention by hosing off and cooling the patient can prevent more serious side effects. Your evaluation and diagnosis was exemplary. A perfect job of getting the answers you needed. Due to your treatment, this animal will recover in no time.
Well, check him out. Leonardo got himself into a little tussle. You should see the other guy.
Is that note of pride in your voice because of the gaping wound on his front right leg? Or the idea that the other guy might be even more injured? Wait, don't answer that. I don't want to know.
Okay, maybe that came out wrong. I'm not glad he's hurt, but cats will be cats.
But must their owners be their owners?
I brought him in, didn't I? I want him to get better.
Oh, there's something we agree on. How about you, Doctor?
I sometimes wonder if I even have enough time for pets.
Please help.
Help with what?
Sasha is sick.
You've got to tell us more.
But I don't.
We can't help him if we don't know what the problem is. Just say it.
He hasn't been eating and his back legs keep collapsing under him.
That wasn't hard. Doctor, I hope that was enough for you to start with.
Sasha could never hurt anyone. He seems tired. He can't even lift himself up, it seems. No. Something for heartworm and fleas.
Those membranes shouldn't be that color. This may be more than just a nosebleed. Something serious is going down. Someone's home, but the lights aren't on. We better hurry. Where did all his blood go? Strange, there's no pain. That's good news, at least. I'm stumped.
You seem so confident.
Highs and lows. Ready for the next step? Clear. That explains all the blood. Now for some clotting action. Stop the blood here, and hopefully it'll go where it belongs. Let's see how this does. Can't read it. Can you? There's a lot going on in here.
Sasha sometimes drinks from my cup. All done. You don't have to say anything now. But I do. I never thought he was poisoned. Thank you, doctor, for saving him.
Sasha put his nose somewhere it didn't belong and got poisoned because of it. When a rat poison prevents vitamin K from clotting the blood, internal bleeding occurs. In most cases, the owner only notices paleness, weakness, or a cold body temperature. Fortunately, we can easily administer vitamin K as an antidote. Your diagnosis was on the money. You didn't waste your time with irrelevant questions. You did a superb job in your treatment.
Oh, somebody took a bite out of Leonardo. Leonardo didn't like that, so we're on the right track.
You never cease to amaze me. You never miss a step.
I'd probably be running a fever too. Need to clear the way a bit. Okay, now stay still. You don't want any infection. Here we are. Now we can get rid of the bad stuff. Well, we're on the home stretch. Well, that's lucky.
Feel something? No.
You ever wake up to a cat purring in your face?
That wound on his right front leg is starting to smell a bit. I don't know if it's abnormal, wink wink, but I heard him and another cat having a hissy fit. Literally.
What can I say? He's pretty tough.
He's pretty lucky. If he had gotten something like feline leukemia, we'd be having another conversation. Or maybe the same one, except you wouldn't be smiling.
So I tried to make him more rough and tumble than a cat should be. I get it.
I knew you were smart.
The bite might not have affected Leonardo as much if it hadn't formed into an abscess, which occurs all too frequently in cats. When the skin heals more quickly than the lower tissues, it effectively seals the infection in. Eventually, pus erupts, and the infection leads to fever. Vets need to pay extra special attention because the bite wounds almost always come in pairs. If you don't see it the first time, look again. Abscess bite wounds usually heal uneventfully, unless an immunosuppressive virus is present. Your diagnosis was on the money. You never sidestepped the important questions. You conducted your treatment quite well.
Who's a beautiful bunny?
Don't talk to her that way. She prefers it when people address her as an equal.
Okay, Hera. What seems to be bothering you today?
Her ear. She won't stop scratching her ear. Perhaps she is trying to tell me to listen more.
Maybe so, because now we're going to listen to what the doctor has to say.
My rabbits enjoy our talks as much as I do.
Her ears must really be itching. Oh, no wonder! Nice and clean. Might be gone.
I must admit, I didn't look closely. She's constantly scratching at her ear. I wish I could take away whatever ails her. I felt a strong feeling of annoyance. Does that help? I'm listening to Hera right now, and she's happy to know those mites will be going away soon.
That's gotta be the first time I've ever heard someone say that.
Really? I'm surprised you don't hear it all the time. You're a wonderful vet, Doctor. I bet all your patients thank you.
Hera was hosting an ear mite infestation. Ear mites look like dirt inside a bunny's ear, but you are most likely to identify them by the brownish scabs that form as a result of the animal scratching. Some store-bought ear drops will kill off the ear mites. The topical medicine you give to Alicia will no doubt do the trick within a couple of weeks. You reached the right conclusion. You didn't waste your time with irrelevant questions. You clearly know how to treat an animal.
Thank you so much for being here. You'd think it'd be easy to find a vet who treats birds. Aren't they common enough? I know all my friends have birds too, and...
That's great you found us. But is there a problem with your bird?
You thought I'd forgotten, didn't you?
No, I just...
Good, because there's something wrong with her beak. Can you see it? Oh, of course you can. Look who I'm asking. She's also had a little diarrhea. Now, should I just leave Rose here?
You might want to leave the cage, too.
Full-service vet? I'm very impressed, Doctor. I can't wait to see what you can do. My friends joke that Rose likes to chirp as much as I do. Oh, I like to give Rose her personal space. Oh, the beak, of course! Oh, it looks all deformed. I don't know what it could be. Oh, she's chirping along like normal as far as I can tell.
Lila talked about this. This cage needs a good cleaning. Oh, I hope she can still see okay. Nothing too serious here. Not fun for Rose, but we learned something.
Oh, what a lovely job you're doing.
Now we'll know what this is.
I don't know if I've ever gone this long without talking.
Have you got it all figured out, Doctor?
I bet when you're done, Rose will sing for you.
I think the mites hurt more than the syringe. Lila will need to know about this medication as well. So many ways to cure this condition.
Maybe I should get another bird so Rose can chat with someone. I'm sorry, were you waiting? Here I I was going on about how hard it is to find a good vet, and I could have saved Rose a lot of discomfort if I had kept her cage cleaner.
You did your best, and some infections can occur no matter what you do.
You're so kind to say so. You're just like my friends. I should tell them about their bird cages too, just in case. Thanks, Doctor.
This poor bird was suffering from both diarrhea due to infection and what some people call scaly face. Scaly face occurs when a facial mite forces a white crust to grow around the beak. We can blame Rose's other problem on a Giardia infection. It causes not only diarrhea, but itching in some birds as well. Both problems spread through contaminated water, so Lila will have to keep a close eye on what Rose drinks. She has another reason to do so. If the infection recurs, it could spread to other animals, or even herself. Your evaluation and diagnosis was exemplary. A perfect job of getting the answers you needed. You conducted your treatment quite well.
I don't know what is going on, but somebody's got it in for my pets.
I noticed some bleeding on Molly's leg. Do you think something hurt her?
No, I just feel like I spend more time here than at home. Know what I'm saying?
Doctor, I see a lump. I think we need to get started now.
It can be a lot of work keeping 2 cats and a bird. Aside from that lump on her leg, nothing. I didn't want to touch where she was hurt. Aside from hurting herself in the leg, hope it wasn't the cat.
There's that lump. Nearly bit me. Gotta keep clean. That's pleasant. It's a start.
You really pulled me out of the fire again, Doctor. Thanks.
We're just doing our jobs.
Now, I mean this in the best possible way, but I hope I don't see either of you for a long time.
At least until your next regular checkup.
All right, but not a minute before then.
Molly has an external abscess on her leg, probably as a result of her housemate, the cat. It's likely that a scratch was the cause of the lump forming on her leg. With proper treatment, Molly should be just fine, and hopefully, she'll also learn to keep her distance from the cat. You diagnosed this patient accurately. A perfect job of getting the answers you needed. Due to your treatment, this animal will recover in no time. What can I say? Your treatment with all your patients has been exemplary, so you've left me with no choice. It's with great pleasure that I present you with our highest honor, the Excellence Award. You've certainly earned it.